Hello, everyone. Welcome to our May webinar series. My name's Aisha and I'm an accredited practicing dietitian here at CoBody. And this month, we're going to be looking at mindfulness in terms of eating and movement. So just to jump right in, a few things we're going to cover today. So, what exactly is mindful eating and mindful movement? I think the term gets thrown around quite a lot. The difference between things like intuitive eating and mindful eating, what does the research actually tell us, and then how do we actually practically apply it? So the first thing I do just want to mention is there is a brief mention of eating disorders in this webinar. So specifically it's binge eating disorder. We don't go into huge graphic detail, but I do encourage you to step away or skip this if that is something that you might need. And I will share some resources and supports at the end. So to get into it, what is mindful eating? So essentially it's quite a good approach when we look at promoting healthy eating. We know how important healthy eating is in preventing chronic diseases. And it's essential that we find ways to kind of support that and help manage it. And nutrition is one of those things. But I guess the most standard recommendations really just focus on what we eat, like increasing fruit and veggies and cutting back on, high fat foods. And while these are generally quite important, many people struggle to stick to these. And I suppose those recommendations might often be missing, and it does depend on the person, but it often overlooks the psychological side of eating. And that might mean, people that might use food to cope with emotions, even just how much our attention and our external environment affects our appetite. So that's why building an awareness around food and eating habits, through mindful eating can be a more effective and sustainable approach worth exploring for some people. As a testament to its effectiveness, it's worth pointing out that mindful eating has actually already been incorporated into the dietary guidelines in Canada and Germany. So to understand mindful eating, it probably helps to first explore the concept of mindfulness. There is a lot of overlap, as you would imagine. So mindfulness is essentially the practice of intentionally bringing your attention to the present moment with an attitude of openness. Curiosity is a big keyword there, and very much non-judgment. So it involves noticing what you're thinking, feeling, or sensing in your body without trying to change it or fix it or label it as good and bad, which I think comes up quite a lot when we're eating or with nutrition in general. So if the term mindfulness feels a bit abstract or uncomfortable, you're not alone. I felt that way too. Personally, I prefer to think of it as noticing. So it's about becoming aware of what's happening in the moment, both internally and externally, without rushing to react or judge. So I like to refer to it as noticing thoughts, feelings, or bodily sensations, I guess. So that's kind of an overview of what mindfulness kind of looks like. And then mindful eating applies this same approach to eating. So paying attention to the eating experience, using all of your senses, noticing how food looks, how it tastes, smells, feels, and even how it sounds, whether that's a crunch or whatever it might be in terms of texture. It also involves being, aware of your emotions, thoughts, hunger and fullness cues are quite a big one. And I guess before also, that's before, during eating, and after. And again, just trying to approach these moments without judgment or the need to, I guess, immediately react. So at its core, mindful eating is built on 3 key foundations. And again, very, very similar in terms of overlapping with mindfulness, but we'll apply it to eating as well. But essentially it looks at present moment awareness. So being fully engaged with the eating experience. It focuses on acceptance. So allowing thoughts and feelings to be there without trying to push them away, and decentering. So that kind of talks about and refers to observing experiences as temporary events rather than getting caught up in them and I guess letting them control or taking them for kind of fact versus just a fleeting thought. So by practicing mindful eating or simply noticing your experience, you can build a more balanced and connected relationship with food. These 3 components as well very much build upon one another. So for example, like we can employ present moment awareness without accepting or decentering, but the reverse would be quite tricky since we can't really accept or decenter from a thought or experiences until we're actually aware of it. So I really wanted to kind of emphasize the progressive nature of these kind of components and steps towards mindful eating. So we've got the present moment awareness, acceptance, and then decentering, and then how these can kind of interplay during eating experiences. Yeah, so while I guess there's many interpretations of mindful eating, I think it's most helpful to focus on the common ways we can actually apply this directly to eating rather than getting caught up in all the variations. But one example, for present moment awareness, and, this is really the foundation of mindful eating. So it involves, like I've said, paying attention to the experience of eating, noticing things, the color, texture, taste, whatever it might be. So for example, taking a bite of an apple and focusing on the crunch, the sweetness and the feeling of chewing without distractions and screens and multitasking. I think that's a big one. These days with the world we live in, is we're kind of either watching something on TV or we're scrolling on our phone, all of which, sometimes is unavoidable or normal or, needed to de-stress. But I think we should be aware of how this affects our behaviors with eating, takes away our awareness, I suppose, from the food that we're actually eating, and doesn't allow us to kind of pay attention to these things that we've spoken about. When it comes to acceptance, so allowing thoughts, emotions, and any sensations to arise without judgment. I think the without judgment part is quite challenging for many people, and not trying to change them, I suppose. So it's definitely, I want to stress that this does really take practice, but first starting with that awareness, I think is the key step. So acceptance would be building on that awareness. So an example might be noticing that you have a craving for chocolate or a particular food, but what we're aiming to do is not kind of move that step further to labeling it as bad or naughty or weak. A craving can be a really natural response, and that might be to stress, or it might be to genuine hunger, it might be to feelings of sadness or excitement or whatever it might be. And then lastly, when we look at the third kind of foundation, is the decentering. So I do think this one's probably the most tricky. And again, that's why we emphasize it definitely is a sense of progression through these stages. But this involves viewing thoughts and feelings as temporary and separate from the self. So recognizing I'm having this thought rather than I am this thought. So helping reduce the reactivity, I think, sometimes that comes with emotional eating or just eating in general. I think one of these examples might be the thought of I need to finish everything on my plate, and I see that sometimes quite a lot. But it's just a thought. It's not actually a rule that you have to obey or that someone has to obey. This kind of looks at a little bit further into applying it to eating, and like any dietary approach, mindful eating should be tailored to fit you and your individual needs and circumstances. And we employ mindful eating in practice in different ways depending on someone's needs. So I would say that present moment awareness is certainly the prerequisite for both acceptance and decentering. You can't really accept or step back from an experience that you haven't noticed. You might start honestly by just thinking or just noticing how you eat, and that could be in any way that sort of comes up for you. Over time, you might begin to acknowledge and accept some of the emotional responses that come with either eating or those maybe prior or post-eating, trying to decenter ourselves from any shame or guilt, learning to just observe cravings and habits, or ways of eating as mental events, or thoughts around eating as mental events rather than facts or rules. What we're aiming to do is allow more freedom for someone in how they respond in those given moments. The layered progression really supports a more conscious relationship and compassionate eating habits. And I want to say and kind of emphasize that our regular dietary guidelines, behavior change strategies, they don't really incorporate that. It's very much fact and rule. And whilst we always preach around individualizing strategies, it really doesn't always incorporate these psychological layers that come with eating, or cravings or things like that. So I think even an overlap of both, depending on the person, what they need, is helpful. I think we can all kind of benefit from changing our relationship with food from being quite automatic or emotionally driven to more thoughtful and intentional. I wanted to outline the difference between mindful eating and intuitive eating. And I mostly want to do that because these terms get confused quite often, understandably so. That they share very similar values like awareness, self-compassion, listening to your body, but there are differences. And I guess, from the center of mindful eating, the main things very much relate to what we've already talked about, but becoming aware of the positive and nurturing opportunities with food, respecting your inner knowledge, your thoughts and feelings, using all your senses to choose foods that are satisfying and nourishing, acknowledging your reactions to food, like whether you like it, whether you're neutral or you really, really dislike something, but without judgment. Noticing physical hunger and cues to guide when to start and stop eating. And we'll get a little bit more into this, but that is a really key one as well. I just put together a bit of a contrast table as to how they're quite different and in ways that they overlap. But, intuitive eating is a bit of a broader framework developed by dietitians Evelyn and Elise, I think a while ago now, but includes mindful eating. It just goes a bit further, I suppose, in addressing your overall relationship with food, very much rejecting diet culture, honoring hunger, which I think I employ with a lot of mindful eating strategies. But coping with emotions without food, I suppose, and respecting your body. So I think mindful eating is quite a nice way to expand and work towards intuitive eating, which is what we've kind of noted here as well. I am going to hand over to Physio now for some mindful movement.
Hi, I'm Shana. I'm going to talk to you about mindful movement and how mindful movement helps with pain and stress. So mindful movement means bringing awareness and attention to the way you move. It doesn't have to be complex. It could be walking, standing, or even stretching. But what matters most isn't what you're doing, it's how you're fully tuning into your body as you move. So a couple of things I just wanted to outline about mindful movement and what the research has shown.
Shanae, I just can't hear you. I'm so sorry. But let me just have a look and see if I can edit anything here. Edit mic. Have you unmuted yourself as well?
Yeah.
Oh, do you want to come in here quickly?
Yeah. Grace, you can hear me.
Do you want to come in here?
Okay, yeah.
Sorry, guys, 1 second. Lucky we're all close together. There we go.
Okay, should I start from the start?
Yeah.
Okay, so I'll start from the start. So I'm going to talk to you about mindful movement and how it helps with pain and stress. So mindful movement means bringing awareness and attention to the way you move. It doesn't have to be complex. It could be walking, standing, or even stretching. But what matters most is what you're doing and how you're fully tuning into your sensations in your body as you move. So just based on the research, I've just outlined a few points. So number one, it retrains the brain. So pain and stress actually share brain pathways. Mindful movement helps to calm the nervous system and teaches the body that movement isn't dangerous, it's not a threat, and which helps break the pain tension cycle. Number two, it relaxes the body. So slow, intentional movement activates the body's rest and digest system, lowering stress hormones, reducing muscle tension, and actually easing flare-ups. It also builds movement confidence. So what this means is mindful movement gently reintroduces motion without fear, helping people trust their bodies again, especially in conditions like back pain and pelvic pain or like chronic conditions. And then also breaks the pain stress loop. So because when you're in pain, whether it be a musculoskeletal problem or anything like that, pain creates stress in the body, and stress can cause tension, and then tension can worsen the pain. So it kind of feeds into a cycle. Mindful movement actually interrupts the loop by helping people respond to the discomfort more calmly. So as a whole, just instead of pushing through workouts on autopilot, a mindful approach encourages you to tune into how your body feels each day. So it might mean adjusting intensity, pace, and type of movement accordingly. This could mean starting with gentle mobility work, progressing into like strength or cardio, finishing with stretching or breath work to kind of wind down and calm the nervous system. So by checking in with yourself before, during, and after a workout, you're building a deeper awareness of your body's needs, less likely to be at risk of injury, and then you're also building something that's more sustainable, not just about quick results. So I'll hand back over to Aisha.
Okay, what would an online webinar be without some technical issues? Okay, so we'll get back into the mindful eating side of things. Okay, and then there was, this was an important part, and I did want to differentiate between the two. I guess what are the key differences and what are we kind of looking at? So overeating is quite common. Many of us experience it, and it can happen for various reasons, and that might be stress, boredom, habit, or any emotional triggers. Mindful eating can certainly help reduce episodes of overeating and increase awareness, and that's by the things that we've talked about, which include, knowing our hunger and fullness cues, assessing or just becoming aware of any emotional triggers, external distractions like screens or just being in a rush, and I guess sensory satisfaction and enjoyment of food. And those are just a few. I think we've covered a lot more than that already. It encourages pausing, noticing, and responding thoughtfully to the internal cues like we've kind of discussed. But I just want to stress that overeating is not an eating disorder, and it is different from binge eating disorder. Overeating is quite common, natural part of being human, describes, when we eat to the point of, I guess comfortable fullness, but also more likely a bit uncomfortable. It can be intentional. It might be like we've had an extra piece of dessert at a family celebration. Other times it happens, I think, more often without us noticing, like when we're snacking, watching TV, or whatever it might be. We're just kind of not really tuned into what's happening. Binge eating is different. So binge eating disorder is a clinical condition that involves recurring episodes of eating large amounts of food in a short time. Comes with feelings of a loss of control during these episodes, distress, guilt, or shame afterwards. And unlike occasional overeating, binge eating is not simply about eating a lot of food. It involves a sense of, like I've said, like loss of control and intense emotional distress. And there's quite a few other layers to that, and it does require specialist treatment, including evidence-based approaches like cognitive behavioral therapy. It might be additional support from other allied health professionals, psychologists, eating disorder specialists, yes, a dietitian and a GP as well where needed, and sometimes it does require medical and psychological monitoring when needed. Research has actually shown that it might, mindfulness interventions like mindfulness-based eating awareness training might be helpful for disordered eating, but we do need more high-quality studies from what I can see. In particular, I think what we need is some research that compares this strategy to an actual control, and that is just a bit more about the way research kind of needs to show actually if an intervention is effective or not. But whilst it might be a tool, I just wanted to kind of clarify that differentiation there. I do want to note as well that I will include some resources at the end. If you or anyone that might be struggling, if you ever feel you might need to speak with someone, get in touch with us and we can help support, or definitely like a GP as well would be the best point of call. But if we look at, and I think this is, I've included a bit about what the research shows, because mindful eating does and can be difficult for some people to, I guess, welcome, because it is a bit abstract. So I did want to look at the research and some of the facts, I suppose, as to what it's really grounded and based in to support its, use and for people to be kind of open-minded to it a little bit. So I guess one of the key figures behind the development was Dr. Jean Christella. So she began shaping the mindfulness-based eating awareness training that I just spoke about which definitely overlaps with everything we've said so far. And while working with clients, she noticed how many people had lost touch with their body's natural signals of hunger, fullness, and satisfaction. And this loss of connection often leads to things like overeating, emotional eating, or just having generally a bit of a complicated relationship with food. The research was influenced by other groundbreaking research that showed that external cues, so things like our environment, social settings, can really override those internal hunger and fullness cues. And then taste awareness and taste satiety play quite a key role in how satisfied we feel. And our interoceptive awareness, so our ability to sense what's happening inside our body, is quite essential for things like self-regulation and making food choices that actually genuinely actually fill our needs. So I guess, yeah, that awareness being quite a key part again. So rather than focusing on strict food rules or just like willpower, which many dietary interventions may, she began developing these tools that help people reconnect with their body's cues, the hunger and fullness, like we were talking about, paying attention to taste and act like genuine satisfaction with foods, and noticing those emotional or environmental triggers that we all have without reacting automatically. So combining this approach with some CBT principles, mindful eating was kind of shaped into practice that supports healthier, more balanced eating, not through control or restriction, but through awareness and self-compassion. And I think the other part that I found quite interesting was some of the research, particularly those from observational and intervention studies, though I will discuss the limitations on that, but suggest mindful eating is actually linked to healthier habits, and that includes lower intake of fat, sugar, total energy, along with just more mindful food choices in general, and improved motivation to eat in a balanced way. And I think that last part is really key. Motivation to eat in a balanced way is sometimes one of the hardest parts of dietary change. So whether that's just because it all feels a little bit overwhelming. Maybe we're choosing foods, we just really don't like, and that's what we have to swap or include more of. So like I said, that kind of the standard dietary approaches don't always incorporate, likes and dislikes. So applying some mindful eating strategies will help us kind of find that balanced middle ground, instilling habits that make you kind of motivated to stick to in the long term. So whilst it's becoming increasingly popular in both research and everyday practice, I wouldn't be my true research-loving self if I didn't note some of the limitations in research and in practice, and that's why I've included this, is because it does apply to practice as well. Every element of nutrition research and like information has, limitations, so it's still important that we notice that or acknowledge that. But mindful eating is an internal experience, right? It's not a physical behavior. So it's quite difficult to directly observe or measure as an intervention. And that's in research, but also in practice. So how do we kind of measure change or improvement? So researchers are often relying on self-report questionnaires, but this has its limits. So we would potentially use the same things in practice if we were looking at kind of change over time. But I guess the limitations to that is people might rate how important they think mindfulness is rather than how much they actually practice it. Everyone interprets questions differently, particularly depending on their experience with mindfulness or mindful eating. Some people are just naturally more self-aware and reflective than others, and this can kind of influence how they report their habits. And that's okay. We just need to work within that. And I think through working with a good practitioner who is able to lead and guide you and kind of, develop, an understanding that's based on you and a framework that suits you is the key thing. But yes, worth noting. One of the main tools that's used is the mindful eating scale. It's a 28-question survey that explores different aspects of mindful eating, like awareness, acceptance, non-reactivity, so not getting caught up or emotionally caught up in cravings or discomfort, routine, and like how structured your eating patterns are, and then acting with awareness, so making those conscious and intentional choices. So given all these factors, both in how mindful eating is practiced and measured, it's important to take an individualized approach. It is impossible to have a one-size-fits-all approach or make any one-size-fits-all conclusions, but honestly, that's the very thing we would avoid with dietary management and interventions anyway. There is no one-size approach to anything. So the best support when it comes to mindful eating or anything else should be tailored to your needs, your goals, and your situation overall. This just speaks to what I just spoke about. But yeah, emphasizing that awareness and individualizing it based on what we know. How do we put mindful eating into practice? So a bit of a list of who might benefit from mindful eating. Like, are we thinking, do I need to eat mindfully? Keeping in mind it's not a strict rule, but it's just more of a tool that can be adapted, again, to suit your needs. But honestly, anyone that wants to feel more in tune with their body, people who often eat on autopilot or distracted, and I think we're all guilty of that from time to time. Those who experience emotional or stress eating, and it's quite common. Individuals wanting to improve their relationship with food, particularly if you struggle with guilt, shame, or quite rigid food rules, and that does exclude those experiencing an eating disorder. As I mentioned, this becomes much more nuanced with other strategies being necessary. But people who want to either slow down or just enjoy their meals more, working towards balanced eating habits, again, maybe for weight management or any sort of chronic condition it could still be applied to. Children and families, thinking that we want to, the earlier the better, build lifelong healthy habits through curiosity and presence at mealtimes. Older adults or people with changing appetites, I think that can be quite common as we age. Our appetite does change. So tuning back in to support and become aware of hunger, taste, and satiety in times of those physiological changes that occur. And honestly, eating something we do every day, so making a natural starting point for mindfulness, I think we could all benefit from as well. A bit more of a guide, or again, just an easy way or a simple way to start. Again, just because it can feel and sound a bit abstract. So I think the first and one of the most important things to do is just to slow down when eating. Begin by pausing before you have a meal, even if it's just for 5 or 10 seconds. Check in with your hunger and your mood. So try one mindful bite. Notice the color, texture, smell, and flavor. Just chew slowly and see what you notice without judgment. I think something worth noting is that the hormones that actually regulate our hunger and fullness cues, particularly in this context when we're talking about hunger, it actually takes I think it's around like 20 minutes or so for our fullness cues to actually catch up. So for this to kind of be communicated to the brain, to the stomach. So we might not actually notice we're full if we're eating too quickly. So if we can just slow down, I think that's one of the best things we can do. Using our senses. So mindful eating is about tuning into the experience. So our sight, what does it look like? Smell, touch, what are the textures, what's the temperature? Taste, how does the flavor change as you chew? Like, just to slow down and actually consider some of these things. Tune into hunger and fullness cues. And this is a little bit like I was talking about before, am I physically hungry, or is this hunger stemming from maybe a different cause? Where do I feel the hunger in my body? Am I satisfied, or am I still wanting more? Something to remember maybe is genuine hunger is quite slow in its onset. You would kind of, again, try maybe noticing that over the next few days or whenever you're watching this. See how you notice when your kind of hunger genuinely kind of builds, whereas emotionally driven eating or hunger is really quite rapid in onset. It'll be very sudden. So that's kind of one way to just start noticing or reflecting on when or why that's occurring. I always do say, if you are genuinely hungry, honor that. Sometimes it's just about, with mindful eating, what can we reach for that's going to give us more nourishment in that moment? One of the biggest ones, but probably the most difficult, might be noticing the thoughts and feelings without judgment. It's very normal, or I would say quite common, to have thoughts like, I shouldn't eat this, or I'm being bad or naughty. Mindful eating, we really just want to notice these things as a first step, but trying not to get caught up in them. You might say to yourself, that's a judgmental thought. Interesting. And just bring your attention back to the food. Another one I like to use is like, oh, thanks brain, like it's trying to do its job, but really just like decentering and detaching from that thought. It's going to take a bit of practice, but this, again, that decentering we talked about before, where we observe these thoughts as mental events rather than facts or commands, and essentially trying to just allow more freedom in how we respond. Overall, you really don't need to get it perfect. That might be quite impossible. I think building the awareness and having the knowledge is really the first and most important thing. Start small, notice, just pause, tune into the senses, be very kind to yourself. Mindful eating is not a diet. It's just a way of developing a new skill, I would say. It's you trying to be kinder and more connected to, I guess, create a more connected relationship with food and to your body. Try and just start with one mindful moment per meal. And I think that's really great, whether that's just noticing, again, the taste or the texture. It doesn't have to be throughout the whole meal. Like mindfulness is kind of challenging. So just start small is what I would say. Essentially, we just want to build that self-awareness, be a bit more in tune with our bodies, and honestly just use that to our advantage when it comes to nutrition and eating. Some of the resources I like to often share with patients are these. If you would like them, like, if you can't go and find them, like reach out and we can share them with you. I also did just want to note support for eating disorders. And again, just to reach out if you or anyone you know is struggling. Thank you, everyone. If you have any questions, please do let us know. And we will see you next month.